American Hospital Dubai embraced forward-thinking technology before we even knew what COVID-19 was. And they embarked on a multi-phase AI transformation program, with the first phase being the creation of a data lab built within the hospital's data center that would accelerate decision-making and processes. So, how have the initial learnings of the lab given them a head start in the fight against COVID-19?
What made us really stand out is we were able to use our data. We use it against some models that came from external, other data sets from external, like the US or UK. And we complement it with our current encounters that we have in our system, and we were able to provide our clinical staff a forward-looking and predictive analysis of our patients that had COVID symptoms, if you will. And what that helped us is really control what kind of ICU admissions that went in, and we prioritized to our physicians exactly what they need to focus on and what's not.
So do you think that the proactive use of data will make for a healthier population?
The surveillance aspect of it has helped a lot on the COVID worldwide. It's helped us operationally. We've actually applying 3 other models right now, which is how can we prevent asthma patients from coming to ED? And there's proven models for that. No-show rates. And finally is conversion from ED to inpatient. If we have these proper models in place that are proven, and with our partners working on that really can help us from an operational perspective and really enhancing the patient outcomes, if you will.
American Hospital Dubai has embarked on this multi-phase AI transformation program to provide proven predictive model outcomes through patient data to serve the healthcare sector as a whole in a variety of areas. But that does beg the question, how can patient data relieve the pressure on traditional healthcare infrastructures?
What happened in the beginning of the pandemic, and because this was not there, everybody was treated in the same way. Everybody got admitted to the hospital. We spent, or let's say wasted, a lot of resources where it was not necessary, while we did not direct these resources to the areas that were necessary. And relying on artificial intelligence and on data helped us to redirect those resources to the areas where they are mostly needed.
Will we ever get to a point, do you think, where data replaces the so-called traditional bedside manners of doctors and nurses?
It will not replace the healthcare provider. It will complement what he is doing, and it will help him provide a better health care, a better service than he would without this data and without this new developed artificial intelligence.
Tom Urquhart, Emirates News.